Hello, everyone, and welcome to our podcast series. My name is Natalie Tornisi, and I'm a Senior Solutions Manager at Outsource Strategies International. Wanted to take this opportunity to talk a little bit about chemotherapy. Chemotherapy is used to destroy rapidly growing cells in the body. The treatment uses powerful chemicals to kill, slow down, or prevent the growth of cancer cells. In most cases, chemotherapy is used in combination with other therapies such as surgery, radiation, or hormone therapy. However, the effectiveness of treatment will depend on the type and stage of cancer and other related factors like the location of the cancer cells, the patient's previous cancer treatment, and the overall health of the patient. Chemotherapy is considered a systemic treatment, which means it affects the entire body. Though it is an effective way to treat many types of cancer, the treatment has its own risks of side effects. Some side effects are mild and treatable, while others can cause serious complications that can severely impact your quality of life. The treatment is done to stop or prevent cell division, kill the cancer cells, shrink a tumor before surgery, remove any remaining cancer cells, and delay or prevent a reoccurrence, slow the progression of the disease, and reduce symptoms in the later stages, even if a cure is unlikely. In some cases, chemo treatment is also done to treat conditions other than cancer, like bone marrow diseases and immune system disorders such as lupus and rheumatoid arthritis. There are certain side effects that occur during chemotherapy treatment, which include nausea, vomiting, pain, mouth sores, loss of appetite, hair loss, fever, fatigue, easy bruising, and constipation. But most of these side effects do subside soon after the completion of treatment. There are different types of chemo that are administered, and the stage and the severity of cancer would tell which type of chemotherapy you would be provided with. There's adjuvant chemotherapy, which is usually administered after surgery. This type helps to kill the cancerous cells that may remain undetected and help prevent reoccurrence of the cancer. Neoadjuvant chemotherapy is a type of therapy that is administered to shrink two large tumors to make it possible to remove them surgically. Palliative chemotherapy is done for those cancers that have spread radically and are impossible to remove surgically. Physicians may use palliative chemotherapy to relieve symptoms and make complications less likely and slow the cancer's progress or stop it temporarily. Preparing for chemotherapy depends on the type of drugs received and how they will be administered. Physicians will give specific instructions to the patients to get ready for the procedures in advance. They may recommend several tests and procedures to make sure your body is fit to receive the chemotherapy drugs. Blood tests are normally done to check for kidney, liver, and heart functions, and providers may also recommend a dental checkup to test for teeth and signs of infection. Treating existing infections may reduce the risk of complications during treatment, since some chemotherapy drugs may reduce your body's ability to fight infections. If there's any problem, physicians may postpone your treatment or select a different chemo drug and dosage that is safer for patients. Most patients will receive chemotherapy in a clinical setting. The drugs can be administered in different ways, which include infusions into an artery or vein, injections into the muscle or under the skin, injections into the fluid around your spinal cord or brain, by mouth as tablets, liquids, or capsules, and topically onto the skin. Patients who are receiving the chemotherapy intravenously may require a minor surgical procedure to have a thin catheter implanted into a vein to make it easier to administer the drugs. The type of chemo drug patients receive will depend on several factors like the type and stage of the cancer, previous cancer treatments, and overall health of the patient, and the extent of recovery after each treatment. The treatment schedules can be either continuous or it may alternate between periods of treatment and periods of rest. The outlook for a person receiving chemotherapy treatment will largely depend on the type, stage, and location of the cancer and their overall health. In some cases, a patient may receive complete remission. Physicians will regularly monitor the effectiveness of treatment by conducting blood tests and adjust the treatment on that basis. I will include a transcript along with this podcast that will outline the specific ICD-10 codes associated with this condition and treatment. I hope this helps, but always remember that documentation and a thorough knowledge of payer regulations and guidelines is critical to ensure accurate reimbursement for the procedures performed.